In this module, we will cover two sets of rather different disorders, which have to do with basic biological functions: eating disorders and sexual disorders. In the first part of the module, we'll learn about anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia is characterized by a refusal to maintain a normal body weight, a distorted body image, and a morbid fear of getting fat. We live in a society that glorifies thinness and condemns being overweight. A study showed that teenage girls feared getting fat over dying of cancer. Medical experts tell us all about the health consequences of being overweight, but seldom do we hear about the dangers of being underweight. When in fact, at just about 10% below ideal body weight, the brain begins to shrink. This is what explains some of the cognitive slowing that is often seen in people with anorexia. Although anorexia represents the lowest prevalence rate among the eating disorders, it has the highest mortality rate. More people die of anorexia each year than all other psychiatric conditions combined. Bulimia, which means ox hunger, is characterized by binges accompanied by a feeling of being out of control of the behavior, followed by some sort of compensatory weight control behavior, which can include vomiting, use of laxatives or diuretics, fasting, or excessive exercise. Interestingly, in the same way that people with binge eating disorder feel like failed bulimics, people with bulimia often feel like they're failed anorexics. They crave the ability to be able to restrict their eating, but are just unable to do so. The binging and purging become a coping mechanism for dealing with unpleasant emotions. Binge eating disorder is in many ways similar psychologically and behaviorally to bulimia. The biggest difference is that binge eaters do not engage in compensatory weight control strategies and are therefore obese. But the lack of these strategies is not for lack of trying, nor is this just a lack of willpower. Many of these clients have been on and off diets their whole adult lives. In the next sections of this module, we'll look at gender identity disorder and sexual dysfunctions and paraphilias. Gender identity disorder is now called gender dysphoria. This is a condition in which people experience discomfort and incongruence between their biological sex and their perception of their gender. Sexual dysfunctions are conditions which interfere with a person's ability to perform sexually and/or to enjoy sexual experiences. They include disorders of desire, arousal and orgasm, as well as sexual pain disorders. Paraphilia refers to an intense sexual interest or attraction to inanimate objects, non-sexual body parts, animals, or children. As you'll see later, DSM-5 made a change to avoid pathologizing a harmless fetish.